My name is Dr. John B. Dunphy, and I'm a general medical practitioner based in Carrigaline, County Cork, just outside Cork City. I'm also the head of the scientific committee of the PRM conference, of which we've had a number of conferences which have been extremely successful with international speakers, and in our last conference having 2 Irish speakers as well as a speaker from France. These conferences have been extremely successful, offering people very worthwhile CME points as well as very worthwhile information in a whole field of therapy that is new to most doctors.
Mm-hmm. Can I just ask you one question, Dr. Dunphy? What is the audience? What is your target audience for the conference?
So the target audience are those who are interested in low dose medicine, in this whole new field of low dose medicine. So general medical practitioners, and indeed doctors who want to learn about this whole new paradigm in medicine. So this represents a major paradigm shift, going from heavy duty pharmaceutical based medicines to low dosed medicines.
It's very interesting. I think that's a very timely educational events, because people were wondering and asking about that but didn't know where to get information, so now they know where.
Yes, absolutely. And I would encourage people to come to these conferences where they will get top quality academic information as well as practical information on how to use these new therapies.
Yeah, that's very interesting. Thank you very much. Can you tell us a little bit more about the speakers?
So our recent conference, we enjoyed a top-class international academic presentation from Dr. Pascal Mensa from France, who spoke on micro-immunotherapy, antiviral defense. And this was a fascinating talk and a fascinating presentation. PowerPoint presentation with excellent slides, and beautifully presented and explained, as this is a complex topic for most of us, even those of us qualifying even in recent years would have very little of this information in their academic programs. In my time there would have been virtually no information on this whole area of medicine, so it's extremely valuable to have this presented in a way that's easily understood, and the practical side of it explained. So my own presentation involved a look at paradigm shifts in medicine throughout the years, as this represents a major paradigm shift. I also included a module on exercise, and invited the audience to partake in an exercise program, which to my surprise everybody was very willing to do and enjoyed enormously.
Yeah, I do remember the wave of joy going through the audience when people had a chance to actually take a break from extremely interesting but like very academic, very valuable, but again brain involving lecture, and then they literally could move a little bit and have a little bit of fun and explore their how they feel, and that was brilliant. That really was brilliant.
And from a practical point of view, it gives the audience the practical information on simple exercises that they can then share with their families and with their patients. But also, as you say, when you're listening to highly academic presentations, the brain needs a break from that, and this allows the brain to take a break from the academic, and it allows it then to be open to the next presentation and the next speaker. In addition to that, I also shared some ideas on debriefing, simple debriefing techniques for people with acute anxiety. And acute anxiety seems to be epidemic at the moment. The number of people suffering from anxiety throughout the population is quite staggering, and we need some techniques that allow people to debrief from these acute anxiety type symptoms, rather than using anxiolytic medication, which is addictive and problematic.
And I guess, just sorry to for interrupting you again, I guess all this, the first of all lectures were video recorded, and people can actually look at them and see them, learn the techniques you recommended. So that's that's a practical approach the conference takes, to preserve the knowledge and make it available to other people, even those who didn't have a chance to participate. Okay,
and as was said in some of the PowerPoint presentations, exercise is the ultimate poly pill. It treats the emotional life, it treats the practical life, and the physical life, and it also treats the biology. So it's a very practical and inexpensive therapy that we all should be indulging in.
Very true. Yeah, absolutely agree.
So our third speaker then was Dr. Bastiaan van Etenatten, from Holland originally, who practices here in Ireland, and who has a very big reputation in Ireland for his expertise in homeopathy, and specifically in relation to this conference, for the use of medical devices. He had excellent video material showing how he approached and treated patients with cervical problems, neck pain, upper back pain, cervical pain, and in addition to that, he gave an excellent presentation on the use of collagen and the value of collagen when injected into muscular problems. And that was very practical. From my own perspective, it allowed me to start using these medical devices, which I hadn't used prior to the conference. So it gave me the confidence to start using these medical devices, which I have been using since the conference. So I would look forward to learning more about these medical devices at future conferences.
So that sounds fantastic. So it looks like the conference, besides being an educational event, it's also a support and networking place or event for doctors, for medical professionals in Ireland to exchange experiences, opinions, ideas, and so on. And as you said, maybe someone else will be using these methods and approaches. So how important do you think is networking?
Yes, networking is so valuable and so important. The fact that we have, international speakers as well as Irish-based speakers is hugely valuable to the audience, and it gives a lovely mix. And it makes the whole experience very useful and valuable to doctors working in different parts of the country. And of course, the fact that this conference carries such a generous CME points from the ICGP for Irish College of General Practitioners, that also adds huge value to the experience.
That's fantastic. And also, I guess, people at those conferences, people who are interested in new approaches, in medicine, and who are interested in paradigm shift in medicine, they feel that they're not alone, that there are other people like them. So at the conference like this.
Absolutely.
And I guess we're planning the new one for November. So we're looking forward to to November. We're looking forward to the new program. So do you think will we be able to advertise the upcoming event soon?
Yes, I'm sure the crop of speakers for the next conference will be equally exciting to those we've had already. We've had speakers from Italy in the past who were excellent. Dr. Pera, who's worth checking out on YouTube for anyone who's would wish to. And the quality of speakers which we had in Milan in Italy was superb. So I would encourage people to check PRM on YouTube and the PRM conference website.
And the address of PRM conference website is www.prmconference.com, and you can see the scientific committee there, the photographs and short biographies, and Dr. Dunphy will be there as well as head of scientific committee.
That's an excellent site, and I recommend it strongly to anyone who's interested in learning about this whole new area of medicine.
Thank you very much, Dr. Dunphy, and we're looking forward to seeing you again at the conference. And it's always a pleasure talking to you. Thank you.
You're most welcome.
Thank you.